So here's a case of mine. This is a number of years ago. I can tell because we have this True Vision system, which we haven't had for a number of years. This is a patient, I think they have keratoconus, if I remember correctly. And this is a standard vacuum tree fine. As you know, that when you turn these tree fines, usually each quarter turn is supposed to be around, 75, 80 microns or so you can count as you rotate this. But I found that that's not necessarily always accurate. So even though I'm counting here, and I think I'm only going 8 quarter turns, and you'll see in a moment that this is full thickness. And if you go full thickness with your trephination on a DALK case, you're done. You're not going to be able to even attempt a DALK, at least unless that perforation is extremely small. In this case, you can see, as I'm looking at the graph here, you can see I've just opened up about 2 clock hours or so on the screen to the left. And you'll note here, that large of a opening there, there's no way that you can do DALK. So in this case, you can't even attempt the surgery, and you really want to avoid that at all costs. So how do I do that? Well, I have for the last, I don't know, probably 5 to 6 years, only used this adjustable depth vacuum tree fine. This is available from Moria. I have no financial interest. We only use these tree fines when I do DALK surgery. I only do about a DALK a month or so. So you're not going to go through a lot of these. You'll see here that notch where that 0 mark is indicates the specified depth of the trephination. So you can just rotate that to whatever depth you want. And then you get vacuum. You'll note there's a little dot, little opening here in the center of this tree fine where you align it with the dot on the cornea. Because this is bulkier and you cannot see the limbus, that dot on the cornea, since that's all you see, really has to be accurate to make sure that your trephination is appropriately centered. You cannot, like with normal tree fine, kind of look around it and make sure that it's equidistant from the limbus. So in this case, it's pretty easy. You just turn until it stops turning. And then when it stops turning, that means it's at a specified depth of trephination. And then you take this off. This is a bit wider where it suctions onto the eye. And so eyes that have narrow intrapalpebral openings can be a little more problematic. There you can see that suction ring. See, it's a little bit further away from the limbus as compared to other tree fines. But I really like this because I don't think I've ever gone full thickness with this. And it gives a nice even trephination 360. So I certainly think that all of us who are using DALK, doing DALK, would benefit from using these adjustable depth vacuum tree fines.